Hey, my beautiful friend. I am Teresa Lusk, and I'm the host of the Teresa Lusk Show. Listen, I don't know about you, but I didn't really used to follow things that had to do with my health and things of that nature. But actually, recently I ran into a young woman, and her name is Sam Smith. And I want to tell you just a little bit about Sam Smith. Well, first of all, Sam is a nurse practitioner that spent nearly 2 decades learning the modern medicine way. And it wasn't until she was confronted with the choice between the poke and a job that she realized the system was designed for profits over patients. Now, she's committed to putting patients first and educating anyone who will listen about the current sick care system in America. My friends, help me welcome the awesome Sam. Sam, welcome to the show.
Hi, thank you for having me.
Listen, Sam, I talked to you briefly, and I know that you have a testimony that started back in 2020. Can you tell our viewers a little bit about it?
I'll kind of start with in 2020, March of 2020 specifically. I actually had a baby, and it was my third. And I had been growing, I grew up in modern medicine. And so had him March 2020 when the height of the pandemic was happening. I remember the world basically shutting down. And then I ended up home with three kids and this newborn. And I remember watching the television and thinking, oh my gosh, I'm so scared. I wouldn't let anyone come visit for about 6 weeks. At that same time, I also was working in public health. So I was on maternity leave from public health. So I was getting messages from my coworkers saying the pandemic, all of these crazy things. And I just remember sitting there one day. I'd been watching Fox News religiously from sun up till sundown, watching all of Trump's uh, news briefings with Dr. Fauci and Dr. Bricks, and just being so scared because I had this new baby. We wouldn't leave our house. And then it kind of dawned on me. I remember watching the ticker on the screen, and I'm thinking, who is there some man somewhere that has like the ability to he's just clicking the numbers. It really just didn't make sense in my mind, because what I know, being in the medical community, you don't just have a death and then it's reported. There's multiple steps. There's death certificates that have to be sent. And I worked in public health. I worked in government. Things don't quite move that fast. So I remember I remember saying something to my husband, like, something is off here. So I ended up, I really don't know how I ended up on Telegram, but I remember I started following some people who were really speaking some truth. And then I ended up coming to this group of people in my state where we had Zoom meetings every Thursday, and they were very highly educated. There were some that had been previous military. And so they were saying things like that I had been thinking out loud. And so I was like, things aren't right. Things aren't right. And then I got back from my maternity leave, got back into public health, where I really started to see the red flag. I would become part of the weekly, actually it was daily at first, daily Zoom calls with the state government and then also the CDC. And for the first couple of weeks, it was okay. They would allow questions and comments. And there too, I started seeing in the comments section, like, you're hiding things from us. What aren't you telling us? We are the boots on the ground. What are we supposed to be doing to people, or telling people? And it was very hush hush, and they didn't want to hear about it. Shortly after that, they stopped doing the comments, stopped offering questions, and then it became this is what you're going to do. This is what you're told. There is no questions, and all, like, it became very apparent that it was more of a dictatorship, and this is what we were going to do, versus really caring about the people. And I know the things that they put in place, people think, there's always a meme that I see. Remember when they put the stickers in the grocery store on the floor? They saved our lives. And it's kind of silly now to think about it, because that did nothing.
Right. Right.
But those are the things that they told us that we needed to do. And so, yeah. So then we kind of fast forward a little bit. I ended up leaving public health just because of like all of that. And I was very devastated. I did love my job, and my specific job in public health was an HIV and STD nurse, and I was very passionate about that. I thought I was going to retire in public health. Mind you, I also was very passionate about immunizations. So my children have all been vaccinated. I'll get to my son here, but they have all been vaccinated, and I ran flu clinics, and I gave thousands and thousands of flu shots. I also encouraged the HPV vaccine, which I know we've discussed, because I was an STD nurse. And so I didn't know. I was blindly following. And it wasn't until then, actually March of 2021, after my own son had his MMR and his, I don't even really remember now, MMR, I think it was a Hep A and a varicella, so the chicken pox. A week later, or about 5 days later, he had a full-blown rash. And for about 10 months, he was very sick, to the point where I thought he had leukemia. And I would take him in every single month. And they would just give him an antibiotic and say, he's fine, he'll get over it. And then I literally would go in every month and say, well, we're back for a monthly visit. And so it kind of got to be a joke. But at some point, I just thought, this isn't right. And at the same time, they were pushing the now, COVID poke. And I thought, something is not right. And so all of that was happening. I had found a new position, truly, that I really then was like, this is where I'm led to be. It was working in substance use. And then later that fall, when the mandate started being come down from like HRSA and, making sure everybody any hospital organization, anything, I was pulled into the director's office, and she berated me for quite some time as I'm sobbing, telling her that I think my child is vaccine injured. Something has happened to my child. I've been dealing with this privately. It was a flat out, I don't care. You need to get this to save other people's lives. It's not about you. And so I left. I was very devastated, and I did a lot of praying, and I was like, I don't know where I'm going to go. I don't know what I'm going to do, because right now it's a decision with me and my husband. We are no longer going to get jabs for ourselves, for our children, and for certain, we are not going to get the COVID jab. So I'm unemployable at that point. I have nothing. I don't know what to do. So I spent a couple of months really just not doing anything. Stayed home. I mean, I stayed home with my children, which was, looking back in hindsight, is a complete blessing. And I think that's what God wanted me to do, because I had never had that kind of time with my children. But yeah, that's kind of how I started waking up. So I like to tell people, when I get on social media and people are maybe like having questions or like, oh, well, you're saying things, whatever. I was that nurse that I was also a pediatric nurse. So I also gave those immunizations to those kids. That makes me kind of upset to think about, because I was that person, that nobody even likes right now. Nobody even wants to go to the doctor and be part of those, be forced into doing that. Some people don't care, but I was that person, and I did give those flu shots. So I think I'm a perfect example of people can wake up and can realize that there are, kind of like you introduced me as, I have found that medicine is about profit, and it is not about patients and patient safety.
Okay. So what, obviously you have your testimony that leads you to the point of saying this. Now, I know this, Sam, that there's so much controversy around this. I mean, even doing this segment is risking your social media page, my social media page, which is absolutely ridiculous that we would even have to worry about that. And we discussed that before the show. We said this could happen because there is so much controversy around this. There is so much hush. Why is that? When you say the medical field or some of this, the vaccinations, et cetera, the pokes, why that profit? What do you think is behind it? Why do that to an entire society, an entire nation? tell us a little bit about what you think, especially since you were in the medical field for years and years.
Yeah, the why is always very hard to, I think, explain to people, because I have gone down so many rabbit holes. And if you actually like take a step back, and think about how could there be like these people that are forcing our population into taking these things and putting these things in food, and putting, like we talked about earlier, the dyes in the food. And why are they doing that? Like, what is the purpose? But then when you also see them, I'm trying not to say his name, when you see the people on stage talking about climate change and depopulation and things like that, you're like, but how can it not be true? Which is just it's all so bizarre. But as far as being for profit, I actually have this firsthand working in public health, because there are grants out there that will help providers reach to their patients who may be in rural communities and all of that. So it's just constant money. But they will reach out to patients and send them postcards and send them letters and things that say, you are not up to date on your pokes, like go contact your doctor's office. And then on my Instagram page, I had posted a while ago the Blue Cross sheet that said, providers would get incentives. And so that's not something you're taught about like in school, but it is there. And so those are things as you get into the medical field and you become a provider that you learn kind of after the fact. And so they have things that they call like guidelines. And when you prescribe something or you follow the guideline to a T with a patient, you do get rewarded for that. So one example, say, is for like high cholesterol. I see this a lot. The cholesterol numbers have gone from like this to this just in the last 10 years. And the guideline is, if certain person of this age has all of these factors, you put them on a statin. And okay, statins do help. They do lower cholesterol, but the other piece is we do need cholesterol. But what happens is in the background, you have systems that basically look at the provider's patients, look at their diagnosis codes, and then they say, okay, Sam had Johnny, June, and Julie, and they all had hyperlipidemia. And so now, what did she prescribe to them? If she prescribed them the number one medication and continued with that, and the same for all of those patients, she gets rewarded in some way for that. If she doesn't get rewarded, like the system does.
Mm-hmm. I've been wondering about that, because you hear a lot of people they say that, doctors get kickbacks for this. And I actually asked a doctor one time, I said, is that true that doctors get kickbacks for certain medications that they keep prescribing? And he just acted like he was just lost. Like, no, what are you talking about? So I've wondered about this. You try not to just be so simple that you don't do your own homework, but it's good to hear that you have that down. Which also leads me to other things. As I was looking through some of your social media, you were talking about things that I actually care about. And I told you, I'm not even huge on, I'm not a hardcore food and medical this and whatever. But as I said, I use my common sense. So when my kids were young, they wanted to eat those little rectangles full of colored icing, and everybody knows what I'm talking about. And you just pop them in the toaster and what have you. And I used to say, not buying you that junk. It's full of dyes that have chemicals in them, carcinogens. And they would laugh at me, because all their friends, moms, get up to pop one of those things in the toaster. And here I was trying to make eggs and bake, something healthier. So we've covered the whole poke thing, that there are issues with that. There are things. And I know, listen, Sam, this is a debate that so many people are going to go back and forth with. Some people, because they got the poke, they feel offended that we would even be doing this. This isn't to offend anybody. It's really just to educate people and say, guys, listen, here in a couple months, they're going to start telling you that flu season is coming and it is time for you to get your poke. And so we're gonna, so we're just educating you, going, guys, there's different ways to prevent stuff, like, hey, wash your hands, eat healthy, get some vitamin D, take a walk, things of that nature that could help. And in the same way, and we can come back to this topic in a second, but also the things in food. I really believe, and I'm not even a doctor, but I believe that the tie to so many cancers is in the food. So let's talk about that briefly.
Yeah, so the dyes especially is something that I really actually recently have been. I will admit, I was one of those, put them in the toaster and let's get going. Until recently, when we've had some struggles with my daughter. And after 2 evaluations and being told she has ADHD, and at the last one, we were told, listen, she can't even focus. She just you need to put her on medication. And I'm like, I'm not going to do that. The medication, that we use for those types of things in kiddos really hasn't been studied long term. And I actually was talking to another provider about this, what they really do to your heart and things like that over an extended period of time. And so we're giving this to little kids when in reality, we need to really look at nutritional deficiencies, which is partially due to the food that we are consuming. Because, you think of some of the new things that they're putting on, like the fruits and stuff like that. Why are we doing that? And then again, to the dyes and we are I think one other country allows for those dyes in really tons of all these chemicals to be put in our food. And so going back to like your question of why, I don't know how to pinpoint it, and I don't know why that's happening to us, but when we are consuming these things, it's causing a whole gamut of problems. Sugar is literally the number one reason for a lot of chronic diseases, and we just keep consuming it. And then we have the lifestyle of everything is quick, and so we go to fast food, and nothing really, there's really not, I haven't found a lot of people who use home cooked meals. And then we also have people that have protein shakes, and which are fine to an extent, but it's in moderation. But I think our moderation has gone from 1 or 2 to like half of our diet.
Sure, because it's convenience.
Yes.
Like, it's based on convenience. It's based on our healthy lives, our busy lifestyles. But I can say this, Sam, all I have to do is eat at a certain place or a certain kind of meal or drink a certain drink, and it shows on my face immediately the next day. My eyes will be puffy, my skin will look tired. And I know that right where I'm about to consume it, I will remind myself, Teresa, tomorrow you are not going to look great because you're eating. That points back, Sam, to something so simple, because I think a lot of people disregard these kind of conversations. And listen, I will say this. I know that we could say that about just about anything, your face regimen, right? Your skincare, your lotions. And yes, but every little change that we make can help you have a better quality of life, no doubt, so same thing with going back to the pokes, there are other alternatives than to going and putting something in your body. I actually suffer from asthma from time to time. And when I get sick, if I get a cold, it goes straight into my lungs. The cough actually will last for months. And I still refuse to go, and I'm like, nope, I'll deal with it. I'll find other ways, because I just don't think that it's necessary to do that. In the same way, there are some foods that I avoid. And I believe, I actually did substitute teaching years ago when I was getting my master's. I was trying to pay for school. And listen, I watched these kids, the parents, and we're speaking to the parents right now. This is not condemnation. It's not judgment. It's, hey guys, listen, the increase of children having struggles in school with the ability to think and focus and behavior issues. Sam, how about that? I'm sure you can, help us even address some of that. But some of this is driven by the food that they eat. And I'd watch these kids, and everything that they had in their little lunch packs were packaged, processed junk. I would almost get anxiety. And listen, I'm not even an organic type person. I'm going to save that extra $10 or whatever, but I'm still going to try to throw in vegetables and fruits and whatever. What do you say to that? What have you seen with that?
Yeah, I mean, again, working in peds, I saw it all the time. The doctor that I was the nurse for, actually, he was the basically go-to guy for all of that. Um, and I could tell that it did help in some of those kids, but it wasn't until my daughter that I'm like, something else. I need to really look at what she's eating or not eating, lack of. So it is that like the first for her and for my daughter, it's nutritional deficiencies. The kid wouldn't eat. She would have my bad. I bought that kind of stuff until I really kind of realized. But
Right.
um, I was really helping her kind of quote unquote disorder along and making it worse for her. And so it's little steps though. I mean, to
Yes.
just completely change everything that you've been doing and I've done in our entire way of life. I mean, not only, as you said, is it expensive to go all organic or all gluten
Absolutely.
free or all of that. And then especially in this day and age, it's sometimes such cost prohibitive that you almost can't, depending on your financial status. And then, um, going back to the school lunches or like even the programs that we have for moms and babies and that sort of stuff, you know, juices, like that's what we're going to give you every month. We're going to give you, you can get yogurts, but they're high in sugar.
Yeah.
So again, but
Yeah.
people need those and they rely on it. But when you're only given a few options and you
Right.
need that assistance or whatever it is, or you just can't afford it to be completely holistic and or organic, that's kind of what happens.
Yeah, and it's expensive. We just said that it is very expensive. We're not sitting here, acting like, well, we don't know. I mean, I was a teen mom. I've been on welfare before. I had to feed a baby boy. I get it. It is hard. It is difficult. You do have to make some choices, but there's other ways to start working on and reading on it. And it doesn't even have to be super thorough. You don't have to be a food scientist to figure this out. Literally just look up ill effects of red dyes, ill effects of metals in your food, ill effects of lotions on your body. And I get that. I was going through the store and I said, I think I'm about to switch to coconut oil for my lotion. But then I saw the price and I said, we're going to wait a couple of weeks because we're going to invest in other things that are important.
Yeah.
So Sam, let me ask you this. So I saw a video. I can't remember if was it your page that I saw it on. Atrazine. Was
Yes.
it your? Did you?
Yeah.
Okay. Can you just quickly tell our viewers what that was about?
Okay.
And again, I know that we will probably be. People may say, "Well, this is conspiracy theory." No, you have to research your food, and like Sam said, there are other countries that don't even allow most of the stuff that Americans consume in their foods. Why? And I have a friend who's constantly telling me, he used to work for the government, high level guy, and he's constantly telling me, Teresa, follow the money. Whenever you're doing your episodes with people, follow the money. So atrazine.
Yeah. So that was actually was RJFK, I believe, and he was on a podcast and was talking about it. It's kind of blown up, but atrazine is in the water, and it has been shown to change the gender of frogs, which I just think is it's incredible. But then it's also incredible to think, why would this be in our water? What is the purpose of that being put in our water? But it is. And you can it was kind of funny. I actually had gotten my water bill and it was like the yearly review of all the levels and stuff like that shortly after I posted that video. And I believe that was on there. Of course, they showed like it was a safe level. But it's just interesting. And then when you go and you think of, so atrazine is a pesticide, sorry. But and then I guess putting it on the crops or wherever it is they're putting it does go into our water supply at some point. But changing gender, and then you kind of, the reason I posted that, because it's like, is this kind of going into why we have an entire generation of people who now are saying that they don't feel like they were
Right.
when they were born.
Yeah.
And, I talk to my grandparents about it often, and it happened quite often, not quite often, but it happened rarely in the 50s and 60s and stuff like that. But now it's so in our face, that kind of stuff. And so, um, is that, again, does it kind of go into those people that have been on stage talking about getting rid of us? Is that, is
I
that the
saw that
goal?
today too. Yeah, I was like, oh, really? Well, thank you. Thank you. You want to just lower the population, huh? Okay.
Yes, I did. And I had posted about, the vice president had just
I
recently
was
said
wondering
that.
if that was you. I'm sorry. I couldn't remember. I do so
Yeah.
much research and whatever, so I couldn't remember whose page I saw it on. Yeah, I was taken away. I was like,
Yeah.
wow. Okay. All
I
right.
think I had saw somebody had said, well, she just meant pollution. And I'm like, but how many times do people have to say the actual word until it's like, why do they keep saying the
Yeah.
wrong word?
Yeah.
So yeah.
Yeah, well, maybe, but I don't know. I think we can use our own common sense to make those decisions. Sam,
Mhm.
this journey must not have been easy for you. I suppose that you get a lot of hate mail, if you will, resistance. Tell us a little bit about your journey and why are you so passionate about doing this?
I think because I had the situation with my son where I had people, I actually worked in that clinic as a pediatric nurse, that I was taking my son to, and they didn't believe me, and they hushed me about those things, and so I started to see that, and then from the side of basically walking away from a job that I was very passionate about, and it opened my eyes, and so I want people to know too that I think while there a lot of people too will say, well, you're all the same, you might have pushed this in the past, you're still the same. I think it's people are changing, people are waking up every day, providers and nurses included, and so I'm passionate about kind of showing the other side, like, hey, I once was, but this is who I am now. And while I can't like give you medical advice, I think that's one of the biggest questions I also get is, hey, what do you think about this? I can't actually do that if you're not my patient. But I can say, like, these are the steps that you could do. These are the things that you can look into and start looking for those providers who are natural,
Mhm.
and who do things a little different and who don't push things on you. So I think I'm passionate about showing a different side. Um, and hopefully giving people hope that I think I'm hopeful. I do pray like every day that this will turn around. I wish it would turn around so fast, but I just think there's so much corruption so deep in all of it, and it's so rooted in it. And again, following the money. I mean, that's exactly it. That to turn it around is probably going to take another decade, but I think we will get there. Um, but trying not to have hateful comments and being respectful, um, will always be better than the latter, I think.
Yeah, absolutely. What's your goal? What do you see yourself doing regarding this? I mean, is this something that you're going to champion on a further level? What do you think?
I don't know. Honestly, I started my Instagram because, like I said, I was kind of like, what am I doing with my life? And then it just got to, I just have, it grew so much. And so I don't really know what I expect there. I know that, I just try to educate people as much as I want, or as much as I can, not want, but that too, I guess. Um, I think just my goal, I actually own my own men's health clinic. And so um, my goal is to continue to do that and serve my patients, um, based on their symptoms and not what Big Pharma tells me.
There you go. Well, you've been such a pleasure to have on. I really appreciate you sharing your story. I know it's been challenging, but I love that you're on the front line, taking your own risks to help people become aware. I didn't know about red dyes until somebody brought it up, and then I did my own research. I didn't become Little Miss Research or anything, but just basic stuff. And it just said, you know what? That makes sense. It makes sense. It's
Mm-hmm.
not natural. So why would I do that? Why would I do that? So, Sam, how can people find you?
Right now, I'm actually just on Instagram. I'm the ungovernable nurse, and that's kind of all. I do have some scattered. I'm on Truth Social and stuff like that, but I don't really post there. I am pretty busy. I do it in my free time. Make reels in my car
Yeah,
when
I
I
saw it. Yeah.
can. Yeah.
Yeah.
My parents found this is funny. My parents found me. I hadn't told them. They knew that I was having like all these my husband would be like, "Oh, she hit a certain amount of people," and they're like, "Well, what is it?" And I'm like, "Well, you just have to find me someday."
Oh,
So,
goodness.
no, I really do it as like an outlet from, like I said, when I had really nothing that I felt like um, was something I was very passionate about. So I don't know. I'm just kind of open to opportunities that come up, and we'll see.
That's awesome. Well, you know what, honey? Keep up the good work. Keep up.
Thank
Keep
you.
being that voice. Keep being the unapologetic voice for people's health. Definitely with research to back things. Because I will say this. Sometimes people will say, well, these are doctors and scientists and whatever. Well, they act like they have the final authority over everything, and it's like, well, sometimes science is their god, and they don't have any ability to look in other ways. Food heals what you eat and what you don't eat. And I can speak to that because I have a son who, my youngest, he's 16. He had some serious stomach issues. They called it leaky gut syndrome.
Yeah.
And I took him to the supposed best pediatrician, best gut pediatrician here in my area. I'm in Dallas, Fort Worth. And he was giving him all sorts of medications to test and see. And I was so concerned because there are some medicines I will take because I know that I need to get rid of an infection or what have you. But there are some things that I just don't believe in testing to see and becoming your guinea pig. So I felt like my child was becoming their guinea pig to these medicines. And so a friend of mine referred me to a natural doctor. That doctor diagnosed him in 30 minutes after just asking a series of questions, blah, 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 said, just change your diet. Mm-hmm. His body has had to heal by itself, all by itself. And the doctor said it'd take about 1.5 years of consistent healing. My child was so skinny, Sam. I mean, skinny. Mm-hmm. And he has finally put some meat on. I am so thankful. When I see him, I'm like, thank you, Lord, that my child is finally gaining weight, that he can, he still has to be restricted in his diet because there's some things that don't work well with his gut, which I'll be honest. How did that happen? You have to ask, how did that happen? And so now we're trying to work with him and reverse the damage that's happened to his tummy. And so, so that story hopefully will help those of us who are watching. You don't have to become fanatics. You just need to become educated and informed, period. And you'll begin to make changes on your own. Sam, you've been fabulous. Thank you so much. Keep up the good work, honey.
Thank you.
And keep going out there and changing the world.
Thank you.
You take care. God bless.
You too.